Welcome back. In today's video, we're going to cover how to find patient information. So as we work our way from left to right within the information bar, we'll notice some patient identifiers as well as a preferred language. And once you hover over weight, you'll get a drop-down pick list of recent vital signs, as well as allergies if they had any, problems, their more recent diagnoses, as well as any active medications. And then orders really should be called lab results, and this is where you view your labs. As we continue our way down, we'll see the patient history grid, and this is where all of our encounters are on file. An easy way to sort through these encounters, especially when you're looking for documents such as a master IM, is to get out of the default mode and just go into documents mode. So this will screen out any encounters where a document wasn't created. So it'll be an easier way to then find a master IM and then review what happened under this day's visit. And they always present the same way. Start off with the HPI, they'll work downwards. You'll get your review of systems, vital signs, the physical exam, any standing orders completed that day, as well as assessment plan towards the bottom of the note. You can also then review whether or not labs were drawn, referrals were made, or any diagnostic studies were ordered as well. Another area to find information is going to be this categories folder. Essentially, the categories folder is where anything that gets scanned into a patient's chart goes. So any paper medical notes written by a specialist would be scanned into the medical notes folder. Any radiology studies where the findings were faxed back to our clinic would then be found within the radiology folder. So in quick review, up here in the information bar, we can get the weight, list of problems, diagnoses, active medications, view lab results by hitting orders, review old master IMs, as well as the categories folder to then view any scanned in medical notes or imaging studies. Now, when we're ready to view today's encounter and concern, you'll then want to switch back from documents mode to default, and you'll notice under today's date and time an intake template. Once you click into the intake template, it brings you into the next gen program, and it'll usually present the reason for visit first, as well as you'll also see the vital signs panel as well. If you see a note saying see standing order, that means click here just below intake under standing orders, and you'll view the result of any office lab that was done prior to you seeing the patient. Within histories, this is where we can then view any past med or surge, family, and social history. And that's all by clicking into the intake template under today's encounter and then moving from intake to histories, and eventually you'll go to SOAP to then chart the patient encounter. Thank you very much for your time.